Bismillahirrahmanirrahim. With the name of Almighty Allah, who is the most gracious and merciful. This is Muhammad Anwar, PhD scholar, Lincoln University College, and enrolled program as PhD in nursing. My supervisor is Professor Dr. Rojidar, Professor, Faculty of Nursing, Lincoln University College, and my co-supervisor is Dr. Dildar Muhammad, Professor, Faculty of Nursing, Institute of Nursing Science, KMU Peshawar, Khyber Pakhtunkhwa, Pakistan. The topic which I have chosen for my thesis is about challenges and issues faced by nurse educator and Khyber Pakhtunkhwa. First, we will see the introductions of my topic. So this is the introductions. Nurses are widely regarded as the backbone of the healthcare system, providing complex, holistic care to the patients across diverse settings through specialized knowledge and skills. Nursing education integrating theoreticals and practical learning as a fundamental, developing competent practitioners and rely heavily on a qualified educator. Quality nursing education prepare a graduate to navigate healthcare challenges effectively. While nursing education has advanced globally, Pakistan system face a significant challenges, a shortage of masters and doctoral preferred faculties, inadequate infrastructure, insufficient teaching resources, and limited research capacities. Despite approximately 239 nursing institutes nationwide, a few employ faculty with advanced degree. Research consistently identify challenges nurse educator encounter in meeting of WHO competencies, including students' lack of clinical preparedness and motivations, educator limited access to professional development, and difficulty in a clinical supervision and teaching. Uh, my problem statement. So this is the statement of the problem. The environment of Khyber Pakhtunkhwa nursing education in Pakistan is complex and poses numerous challenges that affect the quality of the nurse training and thus the delivery of healthcare. Nurse educators are not exempted from challenges in the social and economic context and organizational culture. Understanding these challenges is essential for designing targeted strategies to enhance nursing education, standard healthcare deliveries in the region. Objective of my studies, the study aimed to explore the challenges faced by nurse educators in Khyber Pakhtunkhwa, Pakistan, and to provide recommendations for improving their teaching environment and professional effectiveness. This is the material and method which I have used. If we talk about the study design, so the qualitative study design was chosen. A study setting nurse educator from different nursing colleges in Khyber Pakhtunkhwa, Pakistan were selected. A study duration 6 months after approval from KMU, ASNRB, and ERB. A sample size for the study was decided upon the data saturation. A total of 24 participants were recruited in the study. 3 group discussions were carried out and 12 individual interviews were conducted to collect the data. If we talk about the sampling technique, so Perfasio sampling technique was used to collect the data. If we talk about the inclusion criteria of my studies, so nurse educator who teach to PSN, post-RN, and MSN level from both public and private institutes were including at the studies, and nurse educator with at least 1 year teaching experience were also included in my studies. If we talk about the clinical exclusion criteria for my study, so if we talk about the exclusion criteria from my study, so nurse educators who are on long leave were excluded, and those nurse instructor who were unwilling to participate in the study, they were also excluded from the study. This is the data collection procedure. Approval was obtained from GC and KMU, SRB, ERB, and a college. A written informed consent was obtained from each participant. 12 interview and 3 group discussions of 4 participants of each group were carried out according to their availability. All these participants were approached. Semi-structured interview guide was used for the data collection. Data collection took 30 to 40 minutes. After the data collection, the participant were thanks. A focus group discussion was also carried out to gather the data from the participants. If we talk about the result of my studies, so this slide show demographic result. If we talk about the gender of the participants, so 17 out of 24 were male, which becomes 70% out of 100, and 7 out of 24 were female, which becomes 29% out of 100. The total participants were 24. If we talk about educational status of the participants, so 11 out of 24 were BSN and post-RN holder. It's become total of 45%. If we talk about the MSN levels education, so 13 out of 24 were MSN scholar, and it's become 54% out of 100, and the total participant were 24. If we talk about the working experience of the participants, so 5 out of 24 were having less than 2 year experience, and 12 out of 24 were having experience between 2 to 5 years of age, and if it 7 out of 24 having more than 5 year education, the total of 24. If we talk about qualitative analysis, so thematic analysis was done after following all the process of thematic analysis. 86 codes were identified. The similar codes were organized to exact 18 categories, and the categories were merged in 4 different themes such as curriculum-related challenges, students-related challenges, institution-related challenges, and professional development related challenges. This is a thematic map. We have identified total of 4 themes. The first one, curriculum-related challenges. The second one is a professional development-related challenges, institutional-related challenges, and the students-related challenges. First, we will discuss about the first theme, which is a curriculum-related challenges. This is also have these themes have 4 sub-themes or subcategories, which is a top curriculums, lengthy course content, and content burden, and non-nursing subject. So these 4 are the sub-themes. The main themes is curriculum challenges. Now we will discuss about these themes and sub-themes, and we will uh, uh, support by the participant response. So the first theme was curriculum related challenges. This is the sub-theme, which is lengthy curriculum, and this is the code. Cover a lot of content. This is the narrations and statement of the participants, and BSN were held to cover a lot of content in just 6 months, in which made in a final term are included. Only in second semester, there are 20 chapters to cover in limited period of time. It was the statement of participant number 21. The second sub-theme is a top curriculums, and this is the code. Generic BSN is a very tough. This is the statement, this is the narrations of the participant. The content curriculum, especially for the generic BSN, is very tough. Most of the teachers are graduated from diploma, post-RN. This gave a very tough time to the students and teacher to cover it. It was the statement of participant for number 3. This is another sub-theme number 3, non-nursing subject. This is the code. Non-nursing subject are the major concerns, and this is the narrations of the participant. One of the issue in the nursing curriculum is a non-nursing subject. The nursing educator can cover the nursing subject, but non-nursing subject are the major concern. It was the statement of participant number 6. Content burden, this is sub-theme number 4, and this is the code. Extra burden on the teacher. The administration is creating extra burden on the teacher. The teacher should be given one major subject. Teacher not only teach, but also prepare paper, test, and evaluate all the students. This is the theme number 2. Second theme. The main theme is student-related challenges. This is the sub-theme, culture constraint, lack of interest, poor merit, and poor performance. So now we will see the sub-theme, themes, sub-themes, codes, and also the narrations of the participants. So this is the main theme, students-related challenges. This is the sub-theme, culture constraint, and this is the core society where the female students are bound to the culture limits. We are teaching in a society where the female students are bound to the culture limits. A female felt hesitation in asking questions and participate less in the class activities, which create a hunger for the student as well as for the teacher and healthy knowledge exchange. This is the statement of participant number 7. Core merit is another sub-theme and don't follow any merit policy. Most of the college nowadays are private and the college don't follow any merit policy except the eligibility to fill the session seat. The college administration took every student, um, which is not only a challenging issue for the students but also for the teacher. And it is the narration statement of the participant number 11. This is another sub-theme, lack of interest. This is the code. Students' interest in the academic is very low. And this is the statement of participant number 15, which for male participant. The students think that these are private nursing colleges and they are bound to promote us to the next sessions. The students' interest in the academic is very low. Even the college administration sent their good performance in the internal evaluation instead of top evaluations. Poor performance, this is another sub-theme, and the performance has badly affected. This is the code. Recently, the education system was badly affected by COVID-19 because at that time COVID-19 bring a big change because the most of education is shifting from the physical to the online pattern. So some of the students were promoted without exam and some have gone to uh, uh, commonly subjects due to the fact that students' performance has badly affected. It was the narrations of participant number 6. This is the theme number 4 and professional development. This is the sub-theme, no career opportunities, lack of support, and lack of job security, and service structure. There is no proper service structure for employee. So this is the sub-theme, no career opportunity. This is the code, how to quit the college. We are working in a private nursing college. If we go for high education, so we have to quit the college or go without pay. Lack of job security, they will terminate you. There is no future in the private college. If the owner gets someone on a low salary, they will terminate you or will say to leave the college. It was the statement of participant number 17. This is another sub-theme, lack of support, and this is the code. Private institute do not support. Apart from the government sector, nursing colleges, the private institute do not support their faculty for higher studies such as MSN, PhD, and other higher education. It was the statement of participant number 16. No service structure, this is another sub-theme, and not follow any designated service structure. Service structure is an important component of the professional development. Private college doesn't follow any designated service structure or sign any financial agreement with their employees. This is the theme number 4 and institutional related challenges. And this is the sub theme equipment, residence, classroom environment, scale, lab, transport, and overloading. So this is the theme. This is the sub theme as equipment, only 2 multimedia. We are facing very shortage of the equipments and medical device. We have only 2 multimedia for 3 sessions. Most of the time, the multimedia is used for administrative or office purpose. For example, meeting and PNC visit and the teachers use for. It was the response of participant number 5. This is another sub-theme, classroom environment. Classrooms are very congested. Most of the college buildings are on rent and they are not especially designed for the nursing colleges. This is the institution-related challenges team, and this is the sub-team Scale Lab. Scale Lab do not fulfill the needs. Scale Lab is one of the most important learning resources of the students and the modern era. Latest latest dummies and simulations are introduced to teach the students, even following the evidence-based checklist. The Scale Labs do not fulfill the needs of the students. Residency arrangement for the faculty. The staff are from different villages and even from the other district. Traveling from the village to the institute is one of the major problems. Traveling may also create a huge financial burden. This is the discussions of topic. The current finding of the study was supported by another similar study which reported four themes: cultural challenges, organizational challenges, educational challenges, and work-related challenges. Similarly, another studies provide almost identical finding, revealing that nursing educator experience several challenges while teaching undergraduate nursing students, including challenges related to the management, decision-making, scale, curriculum, and educational research. The strength of my study. This was the first study in Khyber Pakhtunkhwa to explore the challenges of nursing educator teaching to undergraduate students. The primary authors collect all that information by himself to reduce the data collection bias. The studies may have very strong and rich implications in the nursing teaching society. These challenges can be addressed with effective strategies. This is the study limitation. The first one is a times constant. The study was conducted over a very limited 6 months period of time. Limited participant scope. While the study highlighted challenges faced by nurse educator teaching undergraduate, it didn't include a clinical instructor, a wider group in a healthcare education, limiting the breadth of finding. Underrepresentation of female participants, the relatively low number of the female participants may have restricted the depth and richness of insight together. This is the study implication, the practical implication like curriculum modernizations, faculty development, resource allocation, and policy reform. Second, research implications, for example, expanded scope, gender dynamics, longitudinal analysis, and policy implication like national standards, funding framework, continuing education, and global relevance, resource limited context, and digital transitions. This is the conclusion of my study. The study concluded that nursing instructor in Khyber Pakhtunkhwa face multi-affected challenges, including curriculum overloaded, insufficient institutional support, lack of students' engagement, and limited opportunity for professional growth. Addressing these concerns through systematic reform can significantly enhance the quality of nursing education. These are references from which I made these presentations. And this is a thank you and thank you slides. And if you have any questions, you can ask me. Thank you so much for listening me and giving me opportunity to present my topic. Thank you so much once again.